Hi, today's video is about the 5 layers in the face and what happens to them over time. The first layer is the skin, and that's the outer envelope, and the skin is the biggest organ in the body, and it's responsible for keeping bugs out and protecting us and regulating our temperature, lots and lots of functions. So over time, what happens to the skin is it gets less elastic and it gets more lax. So it's like a pair of tracksuit bottoms. The knees get a bit baggy, and no matter how much you pull them up, they're still baggy. We could then get pigmentation. So here's some of that skin laxity on the back of my hands. We get this pigmentation. We call those splotches and blotches. So ideally we want the complexion to be clear and even and free of blemishes, but these are normal age-related changes from ultraviolet damage. And it's not just sunshine, it's actually just daylight. And even on a cloudy day, there's ultraviolet radiation damaging the skin. And that's why SPF is so important. We then tend to get wrinkles, and these often occur around the eyes and around the mouth, where we've got repetitive movement and repetitive expressions. And we can treat these with various products and various medicines, but they happen quite quickly over time. Also, what happens with the skin is it starts to sag a bit, and over time, again, we can lift it up using various techniques. Underneath the skin, we've got a lovely layer of padding, which is fat, and it's very youthful. And we have superficial fat, which is just under the skin. Then we have muscle, and then we have deep fat. And the fat acts like a sandwich layer with the muscle in between. And the fat just helps the muscles to glide, because we need to really be able to make complex facial expressions, and we need to communicate with one another. So the fat's there for a purpose, and it gives us some insulation as well. So the superficial fat layer tends to slide down over time. So what happens is it just tends to slide. And there are various ligaments like the mandibular ligament here that stop that kind of flow of fat down the face. But the fat pads tend to slide down and they get heavy, especially this one, the nasolabial fat pad, and that gets very heavy at the bottom. We lose a lot of fat here around the eye area and supporting there. We lose fat in the temples. So all that superficial fat is kind of sliding down. And again, we can replace it with various products that add a little volume, and we also want to get a lift. The muscles over time become less effective, but they overstretch a bit. Again, a bit like that analogy with the tracksuit bottoms. So you'll see people like Jack Nicholson, and over time the muscles have become so fixed in their action that he can't even relax them even if he tried to. So what happens over time is we can treat them with things like neuromodulators or what we call botulinum toxin. But essentially those muscles are changing over time and getting less effective. In some areas they're getting more active, like this platysma muscle in the neck, which is responsible for forming these gristly bands called platysmal bands, or forming what we call turkey neck. And we can treat those with various treatments as well, particularly with botulinum toxin. Underneath then, the deep fat is really much deeper, and a lot of it is fixed to bone, and that doesn't slide down, it just shrinks. So we have lovely chubby cheeks as little kids, and then over time we get the deep fat shrinking back, and again we can replace that with various products if we wanted to create a more youthful appearance. What's very important underneath all of that is the bone is changing with time. And we know as we get to middle age and beyond, our hips are thinning, our spine is thinning, we can be at risk of osteopenia, which is thinning, or osteoporosis, which is more severe thinning. But what happens is this is happening at a non-visible level much, much earlier, even in our 20s. So one of the first places to show change is around the eye sockets. And the eye sockets get bigger and provide less support for the eye. And then some of that lovely fat that's cushioning the eyeball tends to bulge out, and we get eye bags. So we get a complex situation of delicate damaged skin, which is thin. We're losing some of the superficial fat. The fat around the eyeball is bulging out, and then the bone is shrinking and not giving as much support. So people will often come in and expect treatment around the tear trough or the eye area to be incredibly simple, and actually it's a very, very complex area to treat. What happens then around the mouth is we're talking a lot and moving that muscle, and we start to lose fat and dental support and bone support around here, and everything kind of folds in and sort of shrinks. And then people come in and they don't like these little lines here, and they say, oh, I've never smoked, why should I have those? But they happen irrespective of whether we smoke or not, because it's that maxilla bone shrinking back and rotating. we're losing dental support, and we're losing fat, and the muscles are getting a different level of activity around the mouth. Men tend to be spared more from the effects of aging around the mouth because they've got thicker skin there that's containing hair follicles, and that gives a strength to the area that lasts for longer. So over time, all of these little changes are happening at every single layer. And again, patients come in and they often focus on things they can see front on, like little lines on the glabella here, or nasolabial lines, or actually there's a whole process of change happening at every single level. And one single treatment like skincare products or skin treatments, or a single treatment like toxin, which only affects the muscle layer, is really not going to improve every layer and give an overall rejuvenated effect to every layer. So when somebody comes in, we're assessing their whole face. We're looking at the proportions of the top third, the middle third, the lower third, how that blends in with the neck and what's happening with the jawline and the chin and the profile, and also how that person's body fat is affecting them, because we don't want to overfill a face and then have a very slim neck and a very slim torso. We call that lollipop head, and we really don't want that to happen. So your expert aesthetic doctor, dentist or nurse will do a full assessment when they see you in clinic and give you a treatment plan that's really going to address what your concerns are, what your timescale is, so how quickly do you want to get an improvement, also what your budget is, because that's really important. And all these layers, it takes time and investment to help correct the signs of aging. So it's not just a quick single transaction or a quick single treatment that's going to fix everything. It's very carefully looking at what's happening with each layer and giving a treatment plan that focuses on the whole appearance and keeps everything really very natural. So one of the reasons people come in and focus on these kind of central features is because that's what they see in the mirror, and they look at these lines. And again, my face is asymmetrical like most of us. One of my nasolabial folds, this one's a bit deeper. One of my marionette lines is a bit deeper. My hairline's a little different. But these are what we see in the mirror looking straight on. But actually, when I smile, my nasolabial folds here get worse, but my overall appearance gets better because the superficial fat pads sit up. So when somebody comes in and says, I just want some filler here, it's often not a good spend of their money, because what's happening is a much bigger process of descent and drooping and volume loss and loss of skin elasticity and change of the muscle and fat and bone structures, which sounds depressing, but it's not actually, because it means then there's much more intelligent way of improving it. So people come into me and their faces like this and they say, fill that. But actually that would just make things heavier. So the solution is really to lift things up really naturally, and I can improve the nasolabial fold indirectly by lifting the cheek, because there's a connective tissue layer underneath, a bit like a mask under my hand area called the SMAS. And if I can do treatments to project or improve the SMAS and lift it, I can often get really nice subtle lifting at the sides here without creating extra volume here in the center of the face. We need a little bit of a gap here underneath the eye so that when we smile, the fat can sit up. So if that's overfilled, and you'll see celebrities who've had that done, the whole face doesn't look natural, and the cheeks look too big, and then sometimes the forehead has had toxin and the lower face is sagging, and there's just a mismatch between those areas. And often then, if the neck hasn't been treated, they're all out of kilter. So I think it's really important that you get a really nice, intelligent and objective assessment of what's happening with the face, and understand that just there are changes happening at each level. And it's not simple, but when you get that mix right of good quality active skincare ingredients, sometimes treatments then like energy-based devices or things like microneedling with a skin pen to build collagen that we're losing over time, you can greatly improve that skin envelope or outer part of the skin. And then looking at what's happening with the superficial fat sliding down, it's very straightforward to help lift it up. And it's actually easier when somebody comes in with a full face with plenty of fat or padding to lift them up, rather than fill somebody who's got a very empty or gaunt face. So there's pros and cons, and generally there are pros to having some nice fat on your face. The muscle activity then is changing, and we can impact that with things like neuromodulators or botulinum toxin. And in Ireland, you have to see a doctor or dentist to assess you for suitability with treatment. And then if they think you're suitable and you're happy to go ahead, they have to administer the treatment themselves. And regulations vary in lots of different countries. For the deep fat then, we want to replace that, and we can do that with things like dermal fillers. And hyaluronic acid is one of the commonest products used because it's safe and predictable in the right hands, and it's also reversible if necessary. There are also various other products called biostimulators, like a combination of dermal filler hyaluronic acid with calcium, which is calcium hydroxyapatite, and they're products like Harmonica from Allergan that can help build collagen. There are other ones like Sculptra or like Lanluma, and they come in various other kind of compositions of products that help stimulate collagen and build the skin architecture. So there's lots of different things we can do. If somebody's genetically got, say, a weak or a small chin in terms of the bony chin, we can enhance that by placing products deep on the bone to give better projection. We can often improve the jawline and the contour by lifting up here. And sometimes people will come in with a double chin or what we call submental fat. And by lifting the jawline, we can improve that indirectly. So we don't always go straight for the area where the concern is. We'll often try and indirectly improve it in another area because we can get 2 or 3 benefits from sometimes those indirect treatments. So if you'd like to know more, feel free to get in touch and give us any questions you have, and we'd be very happy to answer them. Take care. Bye.